Good evening. Welcome to ICMR National Institute of Epidemiology.
Welcome to the SnapStats session. I am Dr. Gilbert.
I am Dr. Shishendu.
I thank you all for joining us with this session.
Hope you are going through the lectures in online BCBR and you are enjoying those. Gilbert, last couple of years I have come across many incidences that students often come to us and say that what is p-value? Often they are the newcomers, like they are starting their PG and then they come across some papers and then they don't understand what are the p-values and other statistical parameters. So it will be nice if we talk about the p-values today.
Yes, so all of us would have come across this term p-value sometime in our career.
Yes.
And so today we will see what p-value is, how to interpret a p-value and how to report a p-value in our scientific publications.
Yeah. But before we go to our discussion, I must tell to our viewers that please, if you have any query, drop your comments and your queries in the comment box. That is number one. We have given you some resource material also. We have given the links. So once we are done, please go through those links and read more. Those viewers who have not joined BCBR yet, we request you to go through the link what we have given again to you and join BCBR. And finally, at the end, we will provide you the link in the comment box, and please give your valuable feedback so that in future we can improve on our session. So with that note, can I request you, Gilbert, to explain p-value to our viewers?
Yes. So p-value, as the term suggests, is a probability value. As we are all aware, a probability value can range from 0 to 1.
Yes.
So p-value is a probability value, but it is a probability of what? So from our previous experiences, we are all quite familiar that a p-value of less than 0.05 is considered statistically significant.
Yes.
But what it really means, we'll see in the next few minutes.
So are you going to give an example, Gilbert?
So let's consider this example to understand what a p-value is. So in this example, a researcher is interested to determine the effectiveness of two drugs, say letrozole compared with clomiphene citrate. For this purpose, he has designed a clinical trial among women with polycystic ovarian syndrome who presented with infertility. The outcome we are interested to study is the percentage of women who conceived at the end of 3 months of treatment. So the researcher here is interested to find whether the percentage of women conceiving at the end of 3 months of therapy is higher in the clomiphene group or is it higher in the letrozole group. In short, he is trying to see if there is a significant difference in the consumption between the two study groups. So in this example, let's consider two scenarios. So in the first scenario, out of 10 women who had received clomiphene citrate, the researchers have found that 2 women had conceived at the end of 3 months of treatment. Similarly, among the 10 women who had received letrozole drug, 3 out of 10 women had conceived at the end of 3 months of therapy. So based on this finding, what do you think, Shishendu? Which drug has a higher percentage of women who had conceived at the end of 3 months?
So Gilbert, if I just go with the numbers, I can say letrozole is working better.
Exactly. So you can see 2 out of 10 patients in the clomiphene and 3 out of 10 patients in the letrozole group had conceived at the end of 3 months of treatment. However, if you just look at the numbers, it is only one additional woman who got conceived in the letrozole group.
Yes.
So there is also a possibility that this could have been due to chance. If a different woman had been enrolled in our study, our results might have been different.
Yes.
So this p-value is the probability of this chance what we are discussing. In statistical terms, the p-value is the probability of obtaining a result purely by chance and not due to any external factors like a drug in this particular case.
All right.
So now let's consider a second scenario in the similar experiment. So in the second scenario, the same 2 patients have obtained conceived with the clomiphene treatment, whereas when it came to letrozole, 7 out of 10 patients had been conceived at the end of 3 months of drug therapy. So, again this time letrozole had a higher percentage of women who conceived compared to the clomiphene group. However, in this case it appears that the result is more convincing. I guess all of us also would agree that the difference what is observed here between the 2 study groups is acceptable beyond chance. Having said that, we cannot completely rule out the role of chance in this scenario. There is still a possibility that these results could have occurred due to chance. However, to me it appears very unlikely.
Okay, thanks Gilbert. So what I understand is like when we are comparing 2 groups and then we find a difference, that difference could be either due to chance alone or that can be due to the external factor. Here for example, the drug is the concerned agent.
Exactly.
Okay.
So, before we go on to see how to interpret a p-value, could you tell us how to obtain a p-value in practice?
All right. Okay. So, how to obtain that I will come, but before that I need to explain something else. When a researcher starts a study, he doesn't know about p-values and all. What he is supposed to do is like he or she has a protocol in hand, he or she has a research question in hand, and then go and do the study. Of course, during the design stage, he or she has talked to the statistician, and so appropriately they have designed it, I hope. And then once they do the data collection, they come back and do the data entry, and finally again go back to the statistician. The statistician picks up an appropriate statistical test or multiple statistical tests which are appropriate for that analysis, and then what they do is like usually nowadays we use only statistical software which is available, and with the statistical software they run some analysis. Along with the result and other statistical parameter, we always get a p-value as well. So basically this is how we get the p-value.
Yes. So now that we have understood how to obtain a p-value, now let's see how to let's understand how to interpret a p-value. So we will go back to the same example what we have been discussing in the previous slide. So in the first scenario, we did find a small difference in the percentage of women who conceived following letrozole compared to clomiphene. It is 3 out of 10 in the letrozole group versus 2 out of 10 in the clomiphene group. However, if I had to feed in this data and perform a statistical analysis for this particular data, I would obtain a p-value. So in this scenario, I would obtain a p-value which is something like 0.60. So what does this p-value of 0.60 mean? So this p-value is well above the agreed cutoff of 0.05. This means that we do not have evidence to conclude that the effect of letrozole is significantly greater than the clomiphene group when it comes to the outcome conception among women with PCOS. So that is the conclusion we are going to make at the end of this particular scenario. So let's look at the second scenario, wherein 7 patients in the letrozole group had conceived following treatment with letrozole. So if I had to feed in this data and obtain a statistical p-value, I would obtain a p-value which is something like 0.01. So p-value of 0.01 means that the observed difference in the percentage of women who conceived following the treatment is in fact real, and the probability of obtaining this particular result purely by chance is only 1 out of 100 times.
All right. So thanks Gilbert again. So what I understand, and for the viewers also, so p-value essentially tells us that what is the probability of getting a result by chance alone. For example, if you have got a p-value of 0.01, that means 1 out of 100 cases, out of 100 chances are there that the result is purely due to chance.
Exactly.
And not due to the external factor.
Yes.
Okay, thank you. And then I request you to tell to our viewers that how to express and how to report p-value in manuscripts or dissertation.
Okay. So Let us see one more example of result table which I had taken from a journal article. Okay. So, this is an example of a randomized control trial wherein the drug remdesivir is compared against a placebo group for the treatment of COVID-19 disease. So, the primary outcomes studied in this particular study are 28-day mortality, and the secondary outcomes include hospital admissions requiring non-invasive mechanical ventilation and hospital admissions requiring invasive mechanical ventilation. So, these are the secondary outcomes involved in this study. So, let us look at the result. So, the primary outcome, out of the 158 patients in the remdesivir group, 22 died within 28 days, whereas in the placebo group only 20 had died at the end of 28 days. So, there is a difference of 1.2% in the mortality. So, it is 13.9% and 12.7%. So, whether this difference of 1.2% in mortality, is it statistically significant? So, going by the p value what the authors have reported, the p value is 0.740, which is way higher than the agreed cutoff of 0.05. So, this tells us that there is no statistically significant difference in mortality between the remdesivir group and the placebo group.
Yes.
So, now let us look at the secondary outcome of requiring a non-invasive mechanical ventilation. So, in the remdesivir group, it is 4.4% of patients requiring non-invasive mechanical ventilation, whereas in the placebo group it is 12%. So, this 12% and 4.4%, is it significantly different from each other? So, again we need to look at the p value. At the end of a statistical analysis, you will obtain a p value, and in this case it is 0.014, which tells us that the observed difference of 7.6%, the difference in the requirement for non-invasive mechanical ventilation, is statistically significant between the two study groups.
Okay, Gilbert, it is worth mentioning that see, the p value here is they have written or expressed is like 0.740. It is not like more than 0.05. So, again if you see the next variable, for that it is written as 0.014 and not as less than 0.05. So, that means researchers must report it as it is, the p value, exact p value, maybe with 2 or 3 decimals like that.
Yeah.
So, okay.
So, Sishindu, what do you think about the cutoff of 0.05?
Well, that is an interesting question, and we often get it. For our viewers, it is only a consensus. Researchers from across the world, they have decided that the cutoff should be 0.05. However, there are some other practices as well. For example, 0.01 or 0.001. But by consensus, let's stick to 0.05 only.
I think that has clarified a myth about the p value which many people had in their mind.
Happens.
So, have you come across any researchers or postgraduate residents coming to you and asking for a result which is statistically significant? Like, what to do if they do not get a statistically significant result?
Okay. So, this is very clear. I must say that, see, you should not go and run behind your p values. As I said earlier, that when you are doing your study, you stick to your data collection, you follow your protocol, that's most important. And then whatever you get at the end of the day, and or your statistician gives you p equal to this, suppose whatever it is, then you have then what you have is like you have 2 options only 2 options. That is, number 1 is p more than 0.05 or p less than 0.05. Now, what if you get p less than 0.05? It is clear that it is statistically significant result. I mean, the difference could be here. So then, when you have a statistically significant difference, report that. Similarly, when you have p more than 0.05, then also you report it as it is. You cannot manipulate it and come back and say that somehow I got it as significant. So you should not run for a significant result. Whatever you get, you report it.
So you mean to say that one should always stick on to the protocol and should never manipulate the p-values and report it as such, and they can still go ahead and publish their thesis or research papers with a non-significant p-value, isn't
Yes,
it?
exactly what I want to say. So you report as it is and report in your thesis or your manuscript wherever you are reporting. Now, Gilbert, I have a question to you which is often not practiced or not asked, that is statistical significance we are talking about. But in clinical setting, we sometimes often call something as clinical significance. What is your take on that?
Yeah. So getting a significant p-value is not the end of the story. So sometimes studies do report a significant p-value,
Alright.
but at the same time we should also examine what is the treatment effect. So is there a real difference between the two treatments which are observed?
Yes.
So unless there is a clinically meaningful or a relevant result, having a significant p-value has no value.
Yeah.
So we should not go just by the p-value, but we need to look at the clinical relevance, whether the observed difference between the two treatment groups and the comparison group, is it clinically relevant or not.
Okay.
So for this, you should what I would suggest is you should report the findings whatever you are getting from your results,
Yes.
along with the effect size as well as the p-value, and you should leave it to the wider audience, the readers,
All right.
to decide whether your observed effect, whether it is meaningful for their clinical decision making or not.
Okay. So what I understood is like again, along with p-value or your statistical significance, you must also leave it on your readers to decide on whether it is
Yes.
some other clinical significance is there associated with it or not, and
Yes.
whether they can take it or not. Okay.
Shishindu, recently I had a friend of mine who's working in general medicine. He is doing a study to identify risk factors of mortality among COVID patients.
All right.
So he had done some data collection, he has entered and analyzed, and then he had got some significant factors. So the
Okay.
p-value was less than 0.05, that's what he told me. So he had two factors which were associated with the mortality. So the two factors were cardiovascular disease and hypertension. So
Alright.
the p-value for cardiovascular disease was 0.04 and the p-value for hypertension was 0.001.
Okay.
So eventually he has concluded that because p-value is least for hypertension, that hypertension is more strongly associated with COVID mortality than cardiovascular disease. So how do you see this?
Because you said a big phrase and I think your friend has done a good study. Let's just summarize to our viewers that, so a study was done when they actually checked two factors with the outcome. Outcome here it is mortality, and then the friend has compared it, or the researchers has compared it with many factors. Out of that, two factors become significant. One is the cardiovascular risk factor and second is the hypertension.
Yeah.
And for cardiovascular risk factor, the p-value is 0.04.
Yes.
Okay. And for other factor, it is 0.001.
Exactly.
Now, we often do this mistake that we want to draw a conclusion that this is more associated with mortality or the outcome of interest than the other risk factor. But this is actually an incorrect practice, what I can say. P-value only tells us that whether a factor is significantly associated with the outcome or not. It doesn't say that how much it is associated or how much it is better than the other factor. So to answer this how much, we have different other statistical parameters. So can I ask you to, can I request you
so
to say some factors like that?
I would
parameters?
add on to the points raised by
Yes.
Sichendu. So if we are interested in finding the strength of association between a risk factor and an outcome, there are other measures of association.
Yes.
So the most common effect measures used are odds ratio, risk difference, or a mean difference. So the value what we obtain at the end of our study is called the point estimate of the effect measure. So there is something known as 95% confidence interval So, this 95% confidence interval describes the uncertainty associated with the point estimate what we obtained from the study.
Right.
So, this point estimate of the effect measure along with the 95% confidence interval will give a better understanding about the strength as well as the direction of association. So, for this reason journals nowadays insist upon reporting the point estimate along with 95% confidence interval rather than just plainly reporting the p values.
All right. So nicely explained. I think that will be helpful for our readers. And now, having said all things about p-values, recently I came across with one paper from American Statistical Association saying that p-values do have limitations, and we should not be over enthusiastic with go for p-values and significant p-values what we are discussing. So can you explain a few among those limitations?
Yeah. So, having discussed so much about p-value, it would be incomplete if you do not touch upon the limitations and the shortfalls of p-value. So, I would suggest the viewers to refer to the paper which was referred by Sishendu. So, it is a statement from the American Statistical Association wherein they have nicely delineated what are the critical factors associated with the use of p-values. So, I would like to read out a couple of important points directly from the paper so that you can understand the gravity associated with the use of p-value in current clinical research. So, the first point is the association recommends that a scientific conclusion or policy decision should not be merely based only on whether a p-value is less than a specified threshold. That is, just because a factor has a p-value of less than 0.05 does not mean that it has to change the practice. Also, most importantly, a p-value or statistical significance does not measure the size of an effect or the importance of the result. So, this is something similar to the clinical significance which we talked about earlier.
Exactly.
So, the paper also outlines a number of other critical factors pertaining to p-value. I would suggest everyone to go back and read that particular material. It is given in the description link below the video. So, considering all these factors, the research community now prefers to supplement or even replace this p-value with other statistical approaches.
Yes, you said it earlier also. Right. Yes. So now can I then summarize? I think it's time for me to summarize the what exactly we discussed so far. So we discussed that what is p-value, and it is only suggests that it's a chance of getting a result by chance and not due to an external factor, whatever it may be. So we defined that, and we also said what should be the cutoff, and of course cutoff is by consensus, by this time. We also said how we should get the p-value. We should not rush for getting a significant p-value, and we also said to you that you must discuss with your statistician first to choose an appropriate answer for what statistical test you are going to apply, whether you do it yourself or your statistician does it for you. And then we also said that how to interpret and how to report your p-value, and once you do that, you must be careful that p-value is not the end, it's not the finish. It only says something to you, it has limitations. So stick to your clinical significance if you have so, if you are working in a clinical setting, and of course at the end you have to come up with some additional statistical parameters, which of course we will discuss in our next sessions.
So, thank you Sishendu for nicely summarizing the key points from the today's discussion, and I thank the viewers for actively participating in the discussion, and right now we will take up few questions from the comment section.
So before we go to the questions, you please keep on posting and your valuable feedbacks, and of course we cannot answer all the questions because we have plenty questions by this time. We request you to go to the BCBR thread, discussion forum thread, and put your queries there as well if your question is not answered today, and we will be more than happy to answer those questions.
So, let us take the first question.
Sure.
So, is it possible that we have a very low relative risk and a significant p value? So, I would like to answer that question. So, I think by very low p value, very low risk ratio, relative risk, you mean the risk ratio is closer to the null value, that is what I presume. So, is it possible that the relative risk can still be closer to the null value of 1 and we can still have a significant p value? Is it possible? In which scenario, when the sample size is very sufficiently large, even a non-significant, clinically non-significant relative risk may get a significant p value. So, this is what we had discussed in the during the clinical significance part.
And again, on contrary, if you have a significant, if you have a larger relative risk, as I understand, although relative risk, I don't know what you meant exactly by saying that low relative risk, you meant like it is closer to 1, as Gilbert said. Even if you can get a higher relative risk, for example, say 4, 5, and your statistical significance or p-value is more than 0.05, that is possible even if your sample size is less actually than what is required. So, p-value is a direct function of your sample size, and so you must stick to your original sample size what you have calculated, and with the help of your statistician. Can we move on to our second question, please? Hope that is clear for to you.
So, the second question is, what is the meaning if we get a p-value of 1?
Is it possible, Gilbert, to get a p-value of 1?
Yeah, theoretically it is possible, but we do not in real life scenarios get a p-value.
Okay, even if you get a p-value of 1 or 0.98, I mean closer to 1, you don't need to worry about your p-value, as I said to you earlier. That is, you must stick to your protocol, how you have designed your study. You must not come out from that, and you must not go behind your p-value. If you get it, report it, that's all.
So, the third question is, what if p is equal to 0.000? Then how to report this p value? Should we report it as p less than 0.001, etc.? So, to answer this, we had already told during the session, we need to report the exact p values up to maximum 3 decimals. So, beyond that it is not going to add any inference. So, if your p value is very low, then it is important that it is better you report it as less than 0.001.
I think that is fair enough, yes, to report it like less than 0.001. And another person has asked, or the same person, many reviewers asked to correct actual value as less than 0.05. Well, some journals do ask this kind of reporting. If your journal asks, you please go ahead with that. But if not, stick to reporting the exact values. Can we move to the next question?
So, if the p value is exactly equal to 0.05, then can we say that the results are statistically significant? So, here the chosen cutoff is less than 0.05. So, cutoff of 0.05 is not considered statistically significant. So, how to calculate p values? Tell us formula how to calculate p values. So, for this session, I think you need not worry about the formula. So, different statistical will have a test will have a different formula. Nowadays, it is obtained from softwares. So, this session is going to cover only about interpreting a p value in the session. Okay. Should we always mention p value even if we are using other statistical methods like ROC curve? Yes, any statistical test what you do is associated with the statistical testing, and you need to report the p values associated with it. If the p value is exactly equal to 0.05, then can we say the results are statistically significant?
I think
no, we have already answered that question.
Okay, so I think that much only we can take for today. We are sorry for other queries which are not answered, but again I am repeating you that please post your queries in the BCBR discussion thread. We will be happy to answer your queries there. That is number one, and we also request you that you have been provided with a Google form link which you can share your feedback to us. Of course, you can tell us what could be the future classes, and we will be very happy to bring those topics to you. And your feedback will help us to improve on what we have done today. And I think with this SnapStats we have done for the first time. So thanks all of you to spare your valuable time with us. We understand the situation, still you have joined with us.
So hope to meet you in the future sessions with a different topic.
Yes.
Until then, bye bye from Gilbert.
And, yes, and of course you please look at the references we have given there. You go through those papers and hope your understanding will be better after this session and after going through those literature. Thank you so much. See you, and then take care till you come back with the next session.
Thank
Have
you.
a nice day. Bye bye.
Bye bye.